we're creeping up to 30% of community-based folks, and communication is a challenge. We have a large base of folks who are differently abled. Some are nonverbal but have phenomenal technological skills. Some can speak a whole conversation with you but can't figure out how to use the phone. So there's a ton of different challenges that we've had. And when you're taking, the regular healthcare challenges in terms of connecting with patients and adding in this component in terms of, their disabilities, we needed to find a way to really connect in a way that was more meaningful. Because of the population that we served, we were also challenged by the pandemic, as everybody was, but our folks were on an extended lockdown, where most people were in the house for 2 or 3 months. Ours didn't come out until December. So how did we still connect with them and get them what they needed in very new and unique ways? So again, even though we're an FQHC, we are, some would say, fortunate in that my population is about 70% Medicaid and Medicare covered, because again, now they're disabled, so they're all mostly under government programs. We do have a small self-pay component, but again, we are the 5 boroughs of New York City's, we're one of 4 providers really that will take on the disabled population outside of the hospital centers. So again, we've got a location currently in the Bronx, Brooklyn, Manhattan, and Staten Island. My Queens site is under construction, and I can't wait because then I can say I'm in all 5 boroughs, which is huge. But again, we had tremendous challenges. My biggest challenge and how I got introduced to Dinesh is the fact that I cannot keep a person in a call center, because I get these great individuals and we train them up and we get them loving what they're doing, and then the hospital offers them $7 an hour more. And I have my board of directors yelling at me on one hand, being like, people are saying they're calling and they can't get through. How are you going to make money if you can't get them through? And then I have a workforce issue where I will hire anybody who has a pulse at this point because I can train them, but I can't keep them. So how do I get stability in that? And, we looked at options. We looked at constantly revolving door people. That was option number 1, constantly training people. And my middle management staff was burning out because they could not be on this perpetual roller coaster of constantly training individuals and not actually having time to do their day job. So then we looked at outsourcing. And outsourcing, while it's a really good option for some people, we had a ton of challenges around, because we needed the agents at the call centers, in this case in the Philippines, to be able to answer and address issues that were not your typical issues. Dealing with somebody who is a patient representative of somebody living in a long-term care agency. That conversation went from 2 minutes to 15 minutes because they didn't understand the nuance. It just didn't translate well. And so training them up was another constant process, because they have the same turnover issues that we have, and it was constantly getting complaints back from the patients. We tried to talk to this person, they couldn't help us, and everything ended up getting escalated back to a person in my center. So that's when we were introduced to Dinesh. I was lucky enough that a friend of mine had connected with him and said, hey, listen, for good or bad, you never say no. It's my rule. I never say no. I will hear anybody out, because you never know when an opportunity is going to hit you. And Dinesh said, listen, I can take your calls and I can automate them. I can work with you.
I want to, you just made me feel really great. I'm the blind date. Right?
You're a blind date from a reputable source.
This is the person you need to be. Before we go on and talk a lot about how we did it, you've heard the problem. Just so we can make it relate better to you folks here. How many folks here are consultants or vendors? Just raise your hand. Okay. And the rest of you, all providers? Okay.
The people who I suffer alongside with. So my buddy, who I have to give kudos to, he said, let's talk to Dinesh because I think he can help us. He was in a similar situation running another FQHC in another part of New York. And we literally every Friday would talk and commiserate. And, you know, we went into it hoping just to get a little stability because I am dedicated to my staff to a fault. And I promise them that technology will never, ever jeopardize their jobs. But what technology was able to do for them was to give them a safety net. Because now if two of their coworkers didn't make it to work, it wasn't an issue and a stress because now they have a safety net. And what the bots have been able to do in my health center is really create a sense of stability. Because that first line of defense, if somebody just needs to cancel their appointment, they can go through the bot, they can be on and off the phones in 2 minutes and they're done. If they need, to talk to somebody, guess what? There's somebody who's actually available without having to sit on hold for 40 minutes waiting until they got through all the people who needed to schedule their appointments. So, it started with the simple scheduling and it really is growing and blossoming because, credit to Dinesh and to my buddy Wyman who's hiding over in the corner. They have been phenomenal in terms of working with me on what the standard person may not ask for. I presented to them the challenge of, well, you're scheduling and rescheduling my folks, but a lot of the people don't want to use the bot because they need prescriptions, because every time they cancel an appointment, they need a refill because they're going to run out of their meds before their next visit. So can you automate that for me in the scheduling too? So sure enough, we got that rolling through. And, Dinesh, I know you're out on Long Island, but my biggest health center's in the Bronx. Yo habla español? And they train the bots to speak Spanish for me. That is about all the Spanish you're gonna get out of me. But my bilingual call center agents worked with Dinesh's team to take their bot scripts and to give it a little bit of a Bronx flair, because, Spanish, you have to have the dialect right. And, now the bots are able to speak with my patients in a way that they can relate. They were very open. My automated bots can respond to touch tone, they can respond to voice. They are patient because some of my patients, it might take them 3 or 4 attempts to get what they want out because of their verbal challenges. But it's opened up doors where my staff is happier because they're not constantly hearing, I spent 45 minutes on the phone waiting to get you. And, that's just, it kills everybody's morale. But it's also made the patients happier because they feel like they're being listened to. And when they have an issue that they need urgently, there's somebody there for them now. So that's the story. Dinesh gets the technical part.
Right, so before we get into the details, let's give you guys a demo, okay? See if I can do anything to get the demo.
Thanks for calling First Health General Hospital. In a minute, your call will be answered by a thinking machine. This call may be recorded for quality and monitoring purposes.
Hi, this is the virtual assistant. How can I help you?
I would like to make an appointment.
No problem. I can help you with that. I have identified you from your caller ID and looked up your doctors. I need to ask you a few questions to confirm your ID. Is that okay?
Go ahead.
What is your date of birth?
March 12, 1995.
And your zip code?
10018.
Martin Smith. Welcome. Which of your doctors would you like to make an appointment with?
Dr. Andrew Blank, please. Sorry, my baby is crying.
No problem at all. I have Dr. Blank's schedule up. When would you like to come in?
Would it be possible in about 2 weeks in the afternoon?
Hold on for a minute while I look. Here we go. We have an appointment available 2 weeks from today on Tuesday, May 19th at 8 a.m. at 955 Main Street. Does that work for you?
Do you have anything a bit later?
How about 10 a.m. or 10:30 a.m.?
10 a.m. works.
Martin, I am confirming your appointment with Dr. Blank on Tuesday, May 19th at 10 a.m. You will shortly receive a text message also confirming the appointment. Thank you for calling First Health General Hospital. Good day.
Okay. So, it actually is as simple as that, but most of the conversations are a lot more complicated. Reason why? If it's a doctor, you have to pronounce their name. My name, Gambhir. Doctors get upset and patients get upset that they can't understand. If it's a prescription, right? Omeprazole. Okay. Omeprazole? Which one is it? Then, if we look at all the work that's done by the people within the call center or the front desk, it's very high pressure. The slot that the patient wants is not available next 30 days. Not going to keep them waiting. If you're a dermatologist, you're a GI, you need to see the person, but no slot is available. So the AI can look just like a person at all the other locations. It just does it much faster that the doctor is at, but does take the insurance. If nothing's available, is there an alternative doctor that the patient can be moved to? Okay. So there's a lot of decision making going on, and it happens much faster. Key thing where we've had good feedback is patients do not get frustrated because instantaneously we can tell them what's going on. Okay? There's no waiting, there's no let me look, there's no typing on the keyboard. We can instantaneously tell them what is available and get them the appointment they need. Now, the neat thing is, right, we're all in this revenue crunch, so we'll talk about the economics of the box. But what we're doing is, if you're calling for a prescription refill, if you as a practice has told us that you want all slots that are open used up, we'll bring the patient back because in Rita's case, the psych drugs, they need to come in every 30 days. If you're a specialist, right, we'll set up the appointments after the procedure as you schedule, as soon as your procedure is scheduled. You're coming in, we know, like I had a colonoscopy. In my case, I have to come back in 5 years. I've already done that, and I'm going to remind the patient 6 months before. So we will bring the patients back. When your patients are coming in, everybody here imagines a new patient has to register on a tablet, right? So what if I told you we can do everything on a phone call by asking 3 questions? Okay? So you have a new patient, we're not going to lose that patient, we'll register the patient and make the appointment, and if you allow us, we'll actually collect the payment right then and there. Okay? So the patient has to come in, and if you set it up properly, they can go right in to the medical assistant and actually do the history with the medical assistant. So, why is that important? Because the copay, the co-insurance, and for high deductible patients, that's a large part of your income right now, and growing larger. And our job, what we've seen is when we book the appointment, we've done some experiments and we're implementing now, we can actually easily collect from at least 30 to 40% of the patients the copays upfront. Let me stop. I'm going to run a demo, but before I do that, I want to go around and ask for questions. So, anybody have any questions?
How long does it take to implement?
Just introduce yourself and ask the question.
Hi, I'm Karen Carlson from Omega Healthcare. I was just curious how long it takes to implement a bot.
So Karen, sorry. It depends. Okay? It depends on if your processes are written down or not. Because when we come in, we have to, for compliance reasons and for your own operational reason, run exactly the same as what you're doing. What we'll do is we'll actually refine the scripts so that the questions are very clear. Right? We don't want somebody saying, yeah, I think so. We want a crisp answer from the patient. Unfortunately, if you're not a mega call center, a lot of the knowledge is in your head, right? And training happens on what I call an apprenticeship model. Somebody sits down next to somebody else. So the time doesn't go into the technology, the time goes into us getting it done. Our model, the way we work, is we don't charge you for that, because we call that part of our design. What you get back as part of the design is you get protocols and procedures that hopefully your compliance people will actually appreciate. Okay? So once we set that up, you have to choose your accents that you want, and you have to choose what sort of voice you want. Once you get past that, we're ready to go. The cutover takes about 2 weeks, working with your telecom people. Okay, working with your IT people.
You don't need IT people to do this. I have about half of an IT person, and literally, we got it done. The design part, I can say, had more help to the health center than I think it did to the automation process, because it made us really look in terms of how uniform were the systems that we had in place. So we really did clean up a lot in that process, because we defined rules that I don't know whether or not Dinesh was prepared for me, but I had one set of rules for the dentist, I had a different set of rules for the behavioral health folks, I had one just curmudgeon-y provider that had to have their own rules to retain them. But we had the opportunity to map everything out, and when we did, we mapped it out with the intent of giving it to Dinesh, and we realized, wow, we just cleaned up a whole lot of stuff that we keep pushing off to the back burner. So it was a nice added bonus. But in all reality, my non-existent IT department, my IT guy helped in terms of the technical stuff, the cutovers and the connections. But other than that, it was really my boots on the ground folks who would get on a call and we'd mesh it all out, and they'd give me a product back to test. And one day we're just like, yeah, I think we're here. Do we need to do anything else? It really was a whole lot less painful than I ever envisioned it was going to be.
If everything is set 4 weeks, if we have to work with you and you guys can work with us, right? If you can work with us, we'll push it out in between 10 and 12 weeks. The key thing is you have to approve the protocol from us interviewing your folks, and there'll be a lot of things in your head we have to get out. But if you work with us, we'll get it out in about 10 weeks. Okay? And if everything is ready, I kid you not, in less than 4 weeks, 2 weeks will go to the telecom cutover and testing that. Okay, and 2 weeks in terms of you approving how we've implemented your scripts. You'll listen to the bot, you'll run through the tests and say, yeah. Okay, next question.
Kevin Barnes, Mass General Brigham. Do you have the option of bypass to a human, and if so, what percentage are bypassed?
So we make sure that the patients can always get to a human. Just think about Rita's case, right? Her patient population. If a caregiver calls, they need a prescription and they need it right away, and the AI says, no, my protocol is this. All they have to say, we've agreed to certain phrases and words. If they say help, if they say operator, if they say doctor, we will hot transfer it to a human.
And the nice side is my staff on the operational side has a console where they can see the entire conversation that the bot has. So when they pick up that call, they don't have to start at the beginning. They can say, okay, I see you're looking for this and you want this prescription, but you haven't had a visit and you have no medication left. Let me see how I can help you. So they don't have to go back to square one. So it's time saving, it's less frustrating for the individual. They don't have to rehash it again, but there is always that escalation module. And I actually have my call center supervisor really just with eyes on that at any given moment, because we know that that's going to be the person who needs that little extra TLC, whether it be the situation or the personality or whatever it is.
So let me just wrap up. There's also the other caller who surprised the heck out of us. They're calling. It was a use case we had never expected. I'm calling to confirm my appointment, 3 in the morning. Appointment's at 9. Okay? So 3 in the morning, Sunday 3 in the morning. Sunday 9 p.m. to 3 in the morning is a popular time to call. Who would have thought, right? And all they want to do is very quickly, right? As soon as they come in, we tell them, your next appointment is on this date. Can we help you with this appointment? And they'll say, just confirm the appointment. And they're done. So we have both cases covered, right? So we know there'll always be a time when people need to talk. And we work, like Rita, the other clients we have, we work to set up the people in the call center to now be trained to handle these more difficult circumstances. Yeah.
Hi there. So I'm Lynn Hildreth with CloudMed, although I spent probably 5 years running a 200-seat call center for Moffitt Cancer Center in Tampa, Florida. So I feel the pain acutely.
Oh.
It's rough
It's
work.
so real.
It's rough work. And, similar to your population, dealing with an oncology population, they're very emotional and it's acute and all the things that we all deal with. But my question is the bot dealing with your scheduling system directly? Is it accessing the scheduling system through a back end? Like that, to me, is where these things get slowed down, all the clicking.
Everything's done in real time with the same systems you're using. So if you're using your EMR for appointments, we're using that. If you're using a certain way to take payments, we do the exact same thing. So that when your people look at it, there's no change in the way things are working in your place. That's why we can get it done so fast.
Yeah.
Right?
I mean, I can tell you, we use eClinicalWorks, and for those of you who suffer that pain, I apologize. eClinicalWorks, the scheduling is fairly straightforward, but there's a ton of boxes and a million things. And basically what First Outcomes did was they kind of mirror it. So it's real and live in First Outcomes, but transfers in real time to ECW. But they were kind enough, my call center is fairly young. And they took issue with the fact that the colors were different. Like, they literally mirrored it the way that we had it set up so that the colors were the change. They didn't have to think. Everything was lined up seamlessly. And they actually liked it better because they streamlined it. So all the extra additional touch points that we weren't really utilizing went away. But my staff is funny. They were very not trusting of it at the beginning, and they'd keep 2 screens open and they'd be like, I just scheduled it here. Oh, it's there. And I would hear they were like, this one took like a minute and a half. And I was like, okay, well, I'll find out why it took a minute and a half. And whenever it would take longer, it was because there was some type of conflict in the scheduling that was getting resolved by the bots, but it was coming over. And honestly, I mean, literally when I say my call center is young, they're probably between 18 and 24 years old. And like it became a game for them. They thought it was great. But they truly adopted it a lot more easily than I thought they were going to. I thought I was going to have to push a little bit more.
We got a question.
Hi, Carlos Gonzalez, formerly Boston Orthopedic and Spine. I had a question. What happens when you have a caller, a patient who is hard of hearing and possibly getting frustrated? How does the bot respond?
The bot will automatically recognize when there's a problem and hot transfer it over. Okay? The bot also gives an option, depending upon where you are. If touch tones are possible, it'll also give the user that option. So the user decides.
Yeah, and I can tell you on our side, those patients, we already had workarounds in place for them. So either their caregivers were calling for them, or they had a direct dial touch tone number with the supervisor to make sure that there was never an issue with that. Because again, my whole practice is based more around accommodations. So, you know, that one we had in place prior, but they actually have liked it because I have one woman, God bless her, she is hard of hearing, she's got multiple disabilities, but she is a feisty Bronx lady. And she marched herself into my office the other day to give me a litany. But she told me that she really likes the fact that she doesn't have to wait for us to open to be able to change her appointment. So, you know, I will take whatever kudos I can get from her. They don't come easily.
Just want to make one point. The reason, right, everybody spends all this money to set up online prescription refills, online appointments, online payments. What really surprised us was this survey that it says across all the generations, people still prefer to call, right? At lunchtime, I was telling folks that they don't want us to call them, but the patients always want to call us. And all we've done, and Rita was one of our first customers, but what we've done is we've tried to silence the ringing so that the people who really need help get the help. That's one. The other win was that if we need people, if all of a sudden, well, it's seasonal. In January, you're going to be dead. In December, you're going to be slammed, right? So the way the bots work is they're always there, and you pay as you use them. You don't pay for somebody sitting in a seat, you pay as you use them. Okay? Now, let's continue with the rest of the presentation.
We go off script all the time.
And then we will take more questions. Okay. Sorry.
Welcome to General Health.
This is the demo for payments.
Virtual assistant. I can help you make a payment on your bill. Do you want to make a payment?
Yes, please.
Okay. I need to ask you a few questions to verify your identity. First question, what is your date of birth? You can reply using month, date, and year. For example, you can say March 9th, 1962.
January 6, 1993.
Great. And what is your zip code?
10001.
I found the matching record. Are you Wyman Tyler or the representative for the patient? You can respond with a yes or no.
Yes, I am.
Your balance is $50.20. To pay the balance, say Pay Now or press 1. To pay a different amount, just say the amount you would like to pay including dollars and cents, or enter the amount on your keypad.
Pay now.
Please say your credit card number.
4114-2653-2260-4514.
And what is the credit card expiring? Say the month and year using the full month name and 4-digit year like March 2024.
April 2023.
Last, what is the 3 or 4-digit security code?
418.
Okay, please wait while I process your payment. Your payment for $50.20 has been processed successfully. Your confirmation number is 1, 2, 3, 4, 5. To repeat confirmation number, say repeat or press 1. Other.
I can tell you my staff love not having to take people's credit card numbers because they are very uncomfortable with the potential accusation that somebody used their credit card number. And so they love not having to have any touch point with it. And it goes seamlessly into the EHR, the payment's reflected, nobody has to touch it.
This slide is just
A deep dive. I'm going to take only a couple of minutes. What does it take? What during that 4-week period and afterwards, what happens? So number one, whether you like it or not, we're going to be with you from the time you start with us till forever, because every day we are training the bot. Okay. When we go live with the bot, we don't know all the accents of your patient population. We don't know all their idioms. Okay? We'll get the majority, but we get some, we've already seen some strange things in the wild. Okay? And then there are some accents. I grew up in Canada. My accent's a mixture of French that I used to speak a place called Newfoundland, which is east of Nova Scotia, right? We're in Boston, right? They have a very Scottish type accent, right? Then I came to New York. So
He ain't used to the girl from the Bronx. Ain't was a hard one for a while.
So the Z's and Z's, right? For example. And I'm not the worst case. There's a lot of cases which we will pick it up. The bot will have transferred everything over to our transcription, our recording, and the patient would have gone to a human. But we don't want that to happen the next time. So our team actually will train the bot. It takes about 24 to 48 hours to train the bot on those cases. So next time, the person, when they call in, they can actually use the AI. Okay? Second thing Rita was talking about, our system actually comes with, think of it like a mini Salesforce or a mini CRM system. You can see all the details about the patient and what happened.